Yes, hello guys and welcome to my YouTube channel once again. Please do not forget to subscribe, to like and to comment. Guys, today we are going to talk about pneumonia, and we are being informed that pneumonia is a form of acute respiratory infection that affects the lungs. You are also being informed to take a note that the pre-existing illnesses such as symptomatic HIV infection and measles increases the risk of a child to contract pneumonia. With those ones, now let us look on causes of pneumonia. And the first cause of pneumonia is Streptococcus pneumoniae. Streptococcus pneumoniae is the most common cause of bacterial pneumonia in children. The second one is Haemophilus influenza type B. Haemophilus influenza type B is the second most common cause of pneumonia in children. And the third one is respiratory syncytial virus, which is the most common viral cause of pneumonia. The fourth one, we are being informed that in infants infected with HIV, pneumocystic gyropathy is one of the most common causes of pneumonia, responsible for at least 1/4 of all pneumonia in HIV infected infants. However, let us look on signs and symptoms of pneumonia categorically. And the first category here, we are going to look on newborns. Signs and symptoms of pneumonia in newborns are 1. Poor feeding and irritability. 2. Tachypnea. 3. Retractions. 4. Grunting and hypoxemia. The second category is infants, whereas signs and symptoms of pneumonia in infants are 1. Cough along with tachypnea, retraction and hypoxemia, which may be accompanied by congestion, fever, irritability and decreased feeding. The third category is on children. In addition to the signs and symptoms in category 1, that is on newborns, and category 2, that's on infants, headache, pleuritic chest pain, vague abdominal pain, vomiting, diarrhea, fungitis, and ontalgia or otitis are signs and symptoms in children. Now, let us look on how pneumonia is transmitted. Pneumonia can be transmitted through 1. Via airborne droplets from a cough or a sneeze. Whereas, when a person sneezes or coughs, little droplets spread through the air. These droplets contains the infectious organisms, and when inhaled may in some instances cause pneumonia. The second is through bacteria or viruses that are in the nose or throat. Whereas if these organisms or if these bacteria in the nose or throat spread to the lungs, they can cause pneumonia. Now, the third category is by inhaling unwanted substances into the lungs. Through inhaling unwanted substances into the lungs can cause pneumonia, and these unwanted substances are things like chemicals, smoke, and other things. Though through blood, during and shortly after birth. It can also be transmitted through blood during birth or shortly after birth. Now let us proceed and look at the treatment of pneumonia at health facility. And now here you have to be very keen, because on children age 2 to 59 months with cough and or difficult breathing, the first, you are being informed that when the signs that appears are cough or cold, there is no pneumonia. and therefore you can take care of that one at home. When there is fast breathing and chest indrawing, there is pneumonia, and therefore you are being informed that oral amoxicillin and home care is good for this. And the third one, general danger signs, severe or very severe diseases. Here you are being informed to take first dose antibiotic and referral to facility for infectable antibiotic supportive therapy. Thank you so much. Please do not forget to subscribe and to like to my YouTube channel, and may God bless you.